Ooh. Hi, everybody. This is Gabby Cano from Transformation and Wellness in Toronto, Canada. And I am happy to introduce to you Leah Guzman, who is an art therapist. Welcome, Leah.
Thank you. Thank you for having me.
Oh, it's my pleasure, and I'm so fortunate to have found you because I've looked for a couple of years actually for an art therapist, and for some reason or another, it just didn't come through. And I'm really glad you accepted to do the interview with us. The first thing I wanted to ask you, Leah, is how did you come across, or how did you become, or decide to become an art therapist?
Oh, great. Yeah. I've always been an artist, always been making art ever since I was little. And in high school, I was really into exhibiting my work, putting it into like juried shows and things like that. And one of the judges had asked me what I was interested in, like when I grew up for college and things like that. And I had let them know I liked art and psychology. So they sent me this little news clipping about this little boy who had an art therapist and he was suffering from cancer. And our therapist had him draw a little Pac-Man to eat away his cancer cells. And he went through remission. He was able to recover from his cancer. And I just thought, wow, that's so powerful, to have like no control, but then like you get to be empowered through the art. So I just thought that was really beautiful. And I was like, I want to do that. I know that's like the path that I want to go in.
Awesome. That's amazing. Okay, so tell us, what is art therapy, and how does it really work, and how do you combine the psychological aspect with the creative, and what are the advantages of doing that?
It's a great question. Yeah, so art therapy it's a therapeutic relationship between like the therapist and their client. And so our therapists are trained just like a licensed mental health counselor. Like it's part psychology, and part of it is art. So what we do is we have different theoretical backgrounds that we learn, just like a clinician would learn, and whether it be like spiritual or gestalt or cognitive behavioral, or so whatever the client's needs are, that's the approach that we'll go on. I use a lot of cognitive behavioral therapy in my practice. And then through that, I I help my clients with whatever their needs. So if they're dealing with anxiety, depression, PTSD, grief, life transitions, those type of things. So basically it's more like it takes a few months to actually start to see the progress, but it is that therapeutic relationship where you're helping someone explore their feelings through the art. So there is talking, we do talk,
Yeah.
but mostly they're able to see like their thoughts, their feelings in front of them. And that's what the beautiful part is that you get to create art about how you're feeling, and then learn coping skills and then way to deal with it through the art making process.
Nice. Okay. And you mentioned that you specifically use cognitive behavioral therapy in your practice. So my next question is, are there different types of art therapy?
Yeah. Just like I was mentioning with the approach that you want to take with your client,
Mhm.
and what their needs are. So if their client is coming from like a spiritual space, then you might want to seek a therapist that have that spiritual background. Or if a lot of my clients that I work with are dealing with depression or dealing with anxiety or post-traumatic stress disorder. So the cognitive behavioral approach works, and it's very like solution focused. We're very working on being able to express your thoughts, but then learn new skills to deal with the emotions so you can like feel better.
Yeah. Okay. And that brings me to the next question, which is, what conditions can be treated through art therapy?
Yeah, it's definitely it supports people who are dealing with a lot of anxiety, depression, like post-traumatic stress disorder, grief, any kind of life transitions. Our therapists are found like in hospitals, the hospital settings, either psychiatric or medical hospitals. We're found in schools, in private practice, people that are dealing with like substance abuse. So it's a lot of different, areas that you can find an art therapist.
Okay, awesome. And then would you say that art therapy has an effect on the mental, emotional, physical, and spiritual aspect of healing? And how exactly does it affect each?
Okay, that's a great question. Yeah. So, like I was mentioning before, with being able to see your thoughts on paper, because you're directed by the art therapist with, the exercises that you're doing together.
Mhm.
But your cognitions, your problem solving, all of that, you can see it. Like you could see like what's going on in front of you. So you're being directed and guided by the art therapist. So that does increase your problem solving. Emotionally, it just the art making is cathartic. It helps relieve stress, so your cortisol levels decrease. um, so that's that physical part, and then the spiritual part also it's like that energy shift. So energetically you're being able to release those emotions, and I always like to think that you're getting into like a higher vibration, that you're able to connect with source, and and you feel better in that way by doing that, because you feel like you're supported and guided in that way.
Yeah, that's awesome because a lot of clients, I'm a psychic medium, but I also do hypnosis. I do a few therapies actually.
Cool.
But when clients come to me for guidance as to how they can develop their intuition, I always tell them to practice whatever creative outlet they are drawn to, because that creativity really helps a lot of people, including myself, connect to their higher self.
Mhm.
It's like a direct link. It bypasses everything. And from a hypnosis point of view, we use a lot of metaphors in hypnosis in order to access the unconscious mind. And
Mhm.
art is one of those ways of, because everything's outside of the logic mind with art. And it's very easy to reach higher levels of consciousness through art. So even people who I get accountants and very analytical people coming to me, and and they're in this internal fight with themselves, and they don't know how to make peace with their spiritual side. So I always tell them, look, you can start by making friends with art first. And they're like, oh, but I'm not artistic at all. And I said, are you actually telling me that numbers cannot be artistic? That numbers can't be creative? And they go, well, I never thought of that. I said, that's why they call it creative accounting. So if you can be creative with numbers, you can be creative with anything. And then it's almost like this world opens up for them and they go, oh my gosh, I've never considered that. So
Mhm.
that's really awesome for me to hear what you're telling us, because um, I don't think people realize just how important art is for mental health and just overall spiritual energy balancing. It's
Mhm.
an amazing outlet, and again, a channel, a really good channel for connecting to their higher self. Um, okay, so my next question is, what other complementary methods do you recommend, or do you recommend any to clients to help support their healing journey?
Yeah, that's a great question. Well, part of like nurturing the creativity, I do a lot of journaling prompts, a lot of writing. I like to do meditation as well, just to help people get into like that the here and now, in the present moment. And then I also do visualizations too, so that they can go on a journey and then put themselves, maybe it might be in the future, or just getting into that feeling of how they want to feel.
Right.
Um, so yeah, those are some other ways that I help them tap in before we start the actual art making.
Awesome. Okay. And are there any potential negative side effects to art therapy?
Yeah, well, a lot, art therapy is getting more well known, which is great, but a lot of people don't know about like the actual, it's a rigorous training that we have to go through. To be an art therapist, you have to have a master's degree. So it's a 2-year program. And so a lot of people are saying they're doing art therapy, but they don't have the training. And so, why is that? dangerous, or how can that, affect people in a negative way, is that you could be doing art with someone and guiding them through like an exercise or an activity, and it could actually trigger things from their past. It could trigger anxiety, a panic attack, something like traumatic that has happened in the past, and that could lead to someone becoming like suicidal, or it could lead like opening a can of worms. And if you don't know what you're doing, that would be devastating, to lead someone to go down that path and not know how to deal with it. So
Right.
that's where the mental health part of having the education and knowing how to guide your clients so they feel safe and supported, and
Mhm.
um, being able to express themselves in a place that's they're going to get the right kind of help. That's
Awesome.
the only thing negative. I think that some people are saying they're doing it and they're not really trained. So that's the only thing negative I could say
Right. Okay.
about it.
Awesome. Now, how does the approach in treating clients with art therapy differ from conventional psychotherapy? And I think you touched on that at the beginning, or other mental health therapies, because there's so many out there.
Yeah, I mean, there's a lot of different ones, and I think it's important for people to just to be open and try different ones. And I
Mhm.
think even like the personality of therapists vary too. So it's kind of like you got to find someone that you really resonate with, and
Right.
you know the the main part is the art part with the art therapist, is that you're gonna just have to be open, even though you're not an artist. You don't have to like claim that you're an artist, but just
Mhm.
being open to using the materials and learning can be very expressive, and it's a lot of fun too. So
Right. Awesome.
yeah.
Um, the next question I'm actually going to skip because we've touched on a little bit of whether you are just art therapy or a combination of modalities, which you mentioned. So it's cognitive behavioral and then art as well. Do you have other types of training that you sort of introduce as well at times, or it's strictly art and psychotherapy?
Yeah, it's just art and psychotherapy. Like I said, I bring in that mindfulness practice of the meditation and
Mhm.
visualization and things like that. But yeah, pretty much it's that.
Awesome. And then how does art therapy complement allopathic treatments for physical conditions? Do you ever get people that suffer from physical pain, maybe car accident victims, and that are dealing with actual physical symptoms? And how does that complement their physical treatment?
Yeah. Well, yeah, I do. I mean, we do work with people that are going through physical pain, that might need to take medication.
Mhm.
And the same thing with even like dealing with like depression and anxiety, is that you might have to take that medication. It might get to a point where you're in this fight or flight mode where you can't think straight, and that helps you calm down. So the research says that medication with actual therapy is the best bet. So
Right.
whether it is like a physical ailment or a mental ailment, whichever one,
Mhm.
it's both of them is actually really helpful or beneficial. I mean, you don't have to take the medication, but if you get to a point where you have an imbalance,
Mhm.
um, it's that's what they say, the best. That's what the
Yeah.
research says the best improvement will be from doing both.
Okay. And what symptoms do you see in people with unresolved emotional issues, particularly women?
Yeah. A lot of stuff stems from childhood, and a lot of times we have to go back and just kind of find out what the core, roots, whether it's just like a limited mindset or a belief or trauma or something that has happened in the past that has stuck with them,
Mhm.
and it's kind of repeated patterns of behavior.
Mhm.
So it's what I see is a lot of low self-esteem, low self-worth, which leads to making poor choices, maybe with in relationships, or it leads to depression, and so it leads to different things that manifest in your life. But when
Mhm.
you're able to do the work, the healing work, like going back and then starting to see those connections and patterns, and then knowing that you can make have control by changing your thoughts and then changing your feelings, which lead to new behaviors,
Mhm.
um, and learning self-care. I mean, I think that's huge, because a lot of times if you're coming from a place where emotionally you weren't nurtured, you got to learn how to nurture yourself. And so I think that like a lot of the women that I work with, it's just teaching them how to do that self-care, and nurture their creativity and nurture that, have a like a plethora of tools to take
Right.
care of themselves. Yeah.
Awesome. And that kind of ties into the next question. You've pretty much answered it. How can art therapy help someone who's recovering from abuse, trauma, dysfunction, or even chronic illness?
Mhm.
And you mentioned that self-care factor is very important for anyone that's undergone anything that's traumatic in their lifetime.
Yeah, just increasing the coping skills, increasing how you deal with your day to day and how you deal with stressors, so that you know that you have something that's going to be helpful for you instead of being hurtful or harmful.
Awesome. And how important is it for us to become aware of the power of our own energy in the healing process?
Mm. Well, you're the one that's got to make the change. Like, it's like you have to make a decision. Like, I
Mhm.
want help. I'm ready to take those steps. So you have to be an active participant in your self care.
Yeah.
Um, and I just feel like I'm kind of like a cheerleader.
Yeah. Yeah.
Rooting you on that you can do this, that I
Right.
support you, and to get you there. Yeah.
Right. Yeah. It's important, I think, for people to understand that the counselor, psychotherapist, psychologist, whomever it is, it's just a guide,
Mhm.
but they need to do the inner work themselves. So
Mhm.
it's a facilitation process, but the people that are actually doing the work is themselves. It's
Right.
not passive therapy whatsoever. You're just guiding them along, and should something happen where they, they're triggered, you know how to handle the situation, but you're guiding them along, and you're not, it's not like taking a pill.
Right.
They're going to have to face some things that are either dark or very painful and whatnot, but in the end, you're showing them kind of like the light at the end of the tunnel.
Mhm.
Right.
Yes. Yes.
Awesome. And can you give us an example of a sample story, or yeah, like a sample story of somebody that has experienced, that were reluctant to start or even try their art therapy? Reluctantly they did, and
Mhm.
then were really surprised at the results that they achieved.
Yeah, sure. I think of a person who just now closing sessions, and she came to me after a while of seeing me, because I have a group called the Creative Soul Online Retreat Facebook group, and so she was a part of the group, and sometimes I present on there, and
Mhm.
she had watched me for about a year and interacted a little bit, and then one day she reached out and she's like, I've been stuck for a long time, and I feel like, you might be able to help me. I've tried some other things and they weren't working, but I would like to try this. And she's not an artist, but she was open to being expressive. She's like, I bought all these supplies, but I don't even know where to begin. So it was fun being able to teach her how to use the supplies and how to just open her heart again, because she was just really depressed and in a really low place. And so just being able to kind of get her out of, she didn't even take medication. She was open to that, but she didn't need to go that route.
Mhm.
But she was able to just really learn how to nurture herself again. And we had to do, a lot of that, the inner child work, and we had to do a lot of that self-care and nurturing. And so she's been able to love herself again, and become socially active again, and really healing within her so that she can offer other people things. So she's in such a better place, and I'm so excited because I've been seeing her art. Like, you could see the transformation in her art, where
In
it
the
was like this
art.
closed
Awesome.
doors to like being open. Like,
Right.
literally, that's what you're seeing now. So it's
Yeah.
like, yay. Because she feels it.
Right.
Yeah.
And it's amazing how we don't realize consciously how our perception is changing, and so our art will change.
Mhm.
Even our writing changes, and we do it at such a high level of consciousness, and then when you don't realize it until you actually see it on paper, or see like the storyboard of things happening, and you go, oh my gosh, but we don't see it when we're in it. We don't realize just how dark in a place we can be, and then
Mhm.
when we see the transition, we go, whoa, okay, that's, I didn't realize that was possible. So that's
Yeah,
awesome.
it's almost like I feel like even like when she reached out, she was just so sick of being stuck, like so
Oh, for
sick
sure.
of like not feeling that way anymore. And I think it takes a long time for people to either like trust or open up because they feel, shamed about even feeling bad.
Yeah.
So it does. I think it just takes a little while for people to like take that step and invest in themselves
Right.
to do it. So
Yeah. And that's the other thing for a lot of people, you know, there's a lot of people, especially here in Canada, because it's now illegal, but that smoke weed.
mhm.
And they say, oh my gosh, I can't afford this, I can't afford that. And I go, but you can afford weed. So it's really about priorities. So
Mhm.
if the weed hasn't worked, please try something else.
Right.
Because and this is why I started this group, because I know that there's so many options for people out there that, and I tell them, some you might resonate with, some you might not, but if you don't really know what's out there, you'll never find it. And they literally don't know where to look. The internet is so vast, and they just, so I figured the best way to do this is through start interviewing people in different modalities, and just show the world what can be done and how it's done, so that
Mhm.
they're a little bit more educated. Okay, so if I were to come to you for an initial consultation, can you walk me through what that would look like?
Yeah. So I do free consultations just to see if we're a good fit, and you like my style and you're open to working with me. I usually like to ask people kind of what they want, what's their ideal for 6 months from now, 5 years from now, and then what they think is stopping them. What are their blocks that they see or perceive? Because a lot of times when we have blocks that we're not really sure, that we don't even see our own patterns. So it's kind of interesting to find out like
Mm.
where you're at and where you want to be. And so usually for the consultation, we don't do art just because it's more of like a 20-30 minute of just getting to know each other. But if we agree on working together, then it would be, I'd let you know what materials you'll be using. We'll chat for like maybe like 10 minutes before we actually start in the art making, just to kind of see where you're at, where you're feeling. And I'll do a warm up where we check in with our feelings. We do some art about that. And then I'll lead you through the art making process.
Right.
Um, and then once that's done, then we reflect on the art. So we'll actually discuss what the art is about and how it directly relates to your life.
Wow.
So that's where the like insight or the ahas come from.
Right. So cool. Um, and as you were describing it, like a million things came to my head, but that might have to wait for the next interview. Okay, so that's an initial consultation. Who is your ideal client?
My ideal client is a woman who is ready to uplevel their life. It's like they're at a place where they might not know how to get to that next step, and they're just looking for some clarity. They're looking for some guidance, and they're just open to trying something new. And that's ideal for me because I love leading people on their journey. So it's like I'm just going along with their journey, but I'm just helping them with insights and um, just boosting them to like fly, so it's just
Right,
like jumping off.
right.
So it's usually when women are like starting a business, or because like
Okay.
when anytime you start something, it's like you're opening up a can of worms, like
Oh yeah.
where do I
Yeah.
go?
All your limiting beliefs start going, no, 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 no.
So it's like they're ready, but they just need that support to take off. Or if they're dealing with like anxiety, depression,
Right,
PTSD, anything like that that feels like they're being stopped.
right,
That's who I like working with, but they have to be open to it, like they're
right.
ready.
Yeah. And I guess from hearing this,
Mhm.
I'm getting that you also can facilitate people who say, I have a goal, and you said, opening up a business, but if I have a goal, but I know that there's stuff in my head stopping me,
Mhm.
then you're the right person to sort of bring that out, and let's figure out what it is that's stopping you, and
Yes.
and how to remove the blockages.
Yes.
Okay, awesome. So manifesting, yes.
Yeah, I have a program and I call it the art of healing and manifesting. So I used to call it the art of manifesting, but then I was like, as soon as we start this, there's so much healing that has to go on first because you have to do the healing work and for it to like to manifest. So you get your vibration, so you can get all the emotionally, energetically aligned. So
Right.
that's why I decided to put the healing in there first, and so the manifesting comes really easy when you get into that alignment.
Right. Okay. And can you give us one takeaway to help in our healing journey?
Hmm. I would say just start now with the self-care. Start now, nurturing yourself, nurturing your creativity, and do it daily. Like, I mean, it doesn't have to be the same thing every day, but just do something for yourself every day. Big hug.
Okay. Right.
Self-compassion.
Yeah. It can be as simple as a hug. Yeah. Because I know myself sometimes too, we're so involved in our life, in getting things done. And to think of, oh my gosh, if I had to paint every day, oh, but you don't have to paint every day.
Right.
You can do other things to self-care.
Yes. Yeah,
Awesome.
I'm going to take a bath tonight. I'm looking forward to
There you go.
it.
Yeah.
Treating
I,
myself.
Epsom salt baths and yes. Okay. Um, so can you tell us about the workshops that you offer and are they online? Are they in person? Obviously right now with COVID, there's nothing going on in person, but are you able to run them online too?
Yeah, I do like a once a month meetup. It's kind of like a little mastermind. It's called the Creative Soul Society, and so we get together and uh, it's really like just kind of like a high vibration where we get together, we create art, and it just really focus on
Nice.
what it is that you want to bring into your life. So that is something that I offer for the community, which is fun and uplifting. And then I also do the art therapy work, so it's like might be a little darker or a little heavier, but it's like that's the cathartic and the healing work too, but that's more done, that's individually.
Awesome.
Yeah.
And if people wanted to contact you, you mentioned the meetup group, but if they wanted to contact you, social media as well as website, how can they do so?
Yeah, thanks for asking. My website is www.leahguzman.com. And then I'm on Instagram as Art Therapy Online and then at Leah Guzman Art.
Awesome.
Those are the
Thank
best ways to
you
reach me.
so much, Leah.
Thank you. You had some wonderful questions. They were so
Thank you.
thoughtful. I really like
Well,
them.
yeah, it was more around let's just try to, and I try to make them consistent with almost, they don't always fit every therapist and every modality, but I try to make them consistent so that people can sort of have, they look at it and start comparing if they need to. But I also always tell them go with what you feel because that's what's going to draw you to the individual. You'll know when you see the person if this is the right person for you, and then have your initial consultation, do the little chit chat, see if this is for you, and one thing that I think is important for all the therapies is just your commitment to it,
Mhm.
because if you're not committed, it doesn't matter how committed the therapist is, it's just not going to work, right? You have to want it badly,
Yes.
and you have to at least be consistent enough during for the duration of the treatment, and
Mhm.
whatever it is, it could be a few months, it could be a few weeks, but just be consistent, and that consistency actually translates into consistency in your life.
Yes. Because
So
something challenging is going to happen along those weeks that you're going to be together. And that's why you're there, so that
right,
for that support. Yeah,
right.
most definitely.
Okay, well, it was a pleasure speaking with you. Thank you again so much, Leah, and
Oh,
I will
thank you
be
for
in touch.
having me.
I'll be in touch in the next little while just to follow up, but we'll be uploading this to the channel, the YouTube channel, the group, and then also my personal page. So feel free to share as well.
Okay, good. If you send it to me, I have a YouTube as well, and I can post it too. That would be great. And tell me more. Can you tell me more about what you do? Because you said you're a psychic, you're a medium.
Yeah, yeah. I'm actually going to stop the recording now, and then we can talk about. Okay,
Okay,
just
I'm just curious.
that's okay.